The content presented on Diagnose Deez is intended for informational and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider with any questions regarding a medical condition. While we aim to share accurate and up-to-date information, we do not guarantee the completeness or reliability of any content. Viewer discretion is advised, as topics may include medical conditions or descriptions that some may find sensitive. Use your judgment and engage responsibly.
You've heard of rare diseases, but have you ever looked into the eyes of one? Today, we're diving into cat eye syndrome, a condition as elusive as its name is eerie. From its genetic roots to its haunting physical markers, this is more than a medical mystery. It's a mirror into the fragile complexity of human development. The Diagnose Deez tree is in the lab, breaking it all down with clinical clarity and sharp-eyed precision. Whether you're a med student, a curious mind, or just someone who wants to understand the hidden corners of human biology, this episode has answers. Let's examine the unexplained. Welcome to Diagnose Deez.
Welcome to the deep dive. Today we're taking a close look at a really fascinating and, well, quite rare genetic condition, cat eye syndrome, also known by its medical name, Schmid-Furcaro syndrome.
That's right.
Our mission here is to guide you through, the stack of sources, everything from the early research that discovered it to the latest clinical findings. We want to cut through all that info and pull out the most important insights for you.
And it really is a deep dive because cat eye syndrome, it presents with such a surprising range of features.
Right.
So understanding its genetic roots and how differently it can affect people is, well, it's incredibly insightful. It really shows you how complex human development can be, right down at the chromosome level.
Definitely. So let's start maybe with the name itself. It's very memorable, cat eye syndrome. Where did that come from? And who were the researchers who first sort of uncovered its secrets?
Yeah, the common name cat eye syndrome, it actually comes from one of the most distinctive physical signs a particular eye abnormality will talk about in a moment. But medically, yeah, it's formally Schmid-Furcaro syndrome. That's in recognition of the two researchers who independently described it back in the early 1960s.
Oh, okay.
So Dr. Hans Schmid, he was a Swiss cytogeneticist, and he was the first. He reported it in 1960. He identified what's called a small supernumerary marker chromosome, an SSMC.
SSMC,
Yeah, basically a tiny extra piece of chromosome. And it was derived from chromosome 22 in a patient who had these characteristic eye and anal malformations.
Interesting.
Then, just a few years later, Dr. Marcella Ficcaro, an Italian cytogeneticist, she independently described very similar chromosomal abnormalities in papers from 1965 and 1967.
So two independent discoveries.
Exactly. And this was pioneering work done in Europe, Switzerland, and Italy. It relied on, the techniques they had back then, early chromosome banding techniques. This was way before modern molecular genetics.
Right. Visualizing chromosomes directly, fascinating history. So moving beyond the history then, what is cat eye syndrome fundamentally from a medical perspective?
Fundamentally, it's a rare congenital chromosomal disorder. It's caused by that extra little marker chromosome, the SSMC, that comes from chromosome 22.
Okay.
And having this extra piece leads to what we call partial trisomy or sometimes tetrasomy of specific regions of chromosome 22.
Trisomy, tetrasomy. Can you break that down?
Sure. So normally we have 2 copies of each chromosome, right? Trisomy means there are 3 copies of a particular section of chromosome 22, and tetrasomy means there are 4 copies.
Okay. Too many copies of just one part.
Exactly. It's like having too many instructions for just one part of the building plan, which can mess up the whole construction. It's classified as a distinct abnormality, and there are even subtypes, type I and type 2, depending on how large that duplicated region is.
Got it.
For doctors keeping track, its official code is ICD-10-Q93.4, which falls under partial trisomy 22.
And you mentioned it's rare.
Oh, yes.
Yeah.
Very rare. We're talking about estimates ranging from maybe 1 in 50,000 births up to 1 in 150,000. Globally, maybe around 1 in 74,000 people. And how it happens. Often it's de novo, meaning it's a spontaneous change, not inherited.
So it just happens randomly.
In many cases, yes, but it can also be inherited in an autosomal dominant way. That happens if a parent has something called mosaicism.
Mosaicism. What's that?
Mosaicism means that the parent carries the genetic change, that extra chromosome, but only in some of their cells, not all of them.
Ah, I see.
And if they have mosaicism, there's about a 50% chance they could pass that marker chromosome on to their child. Mosaic patterns are also pretty common in the affected individuals themselves, meaning the marker isn't in every single one of their cells either.
That sounds like it can make things complicated. Okay, so you've defined it well. Now, for people living with this, what does it actually look like? What are the main symptoms or signs?
Well, the syndrome is often talked about in terms of a classic triad of features. This triad is seen in, maybe 40 to 60% of cases.
Okay, what's in the triad?
First is the iris coloboma. That's the feature that gives the syndrome its name. It's a vertical notch or gap in the iris, the colored part of the eye, making it look a bit like a cat's pupil. Sometimes this gap can extend further back into the retina or choroid.
So that's the cat eye.
That's the cat eye, yes. But, and this is important, not everyone with cat eye syndrome actually has this. It only occurs in about half the cases, maybe 50%.
Oh, interesting. Okay, what else is in the triad?
The second is anal atresia. That means the anus is imperforate or not properly open. It often comes with fistulas, which are abnormal connections.
Right.
And the third part of the triad is preauricular tags, or pits. These are just small skin tags or little indentations usually found near the front of the ear.
Okay, so coloboma, anal atresia, and those ear tags bits. That's the classic triad.
Correct. In about half the cases, give or take.
But you said earlier the manifestations are surprisingly varied. So beyond that triad, what else can occur? It sounds like it can be quite different from person to person.
Absolutely, and that's really one of the most fascinating and challenging aspects of CES. The presentation can be incredibly diverse, even within the same family if it's inherited.
Wow.
So beyond the triad, we see a whole range of things across different body systems. For the eyes, besides coloboma, you might see hypertelorism, that's eyes spaced widely apart.
Okay.
Also, eyelids that slant downwards, maybe microphthalmia, which means abnormally small eyes, or strabismus, where the eyes don't line up correctly.
So other eye issues too.
Yes. And then cardiac defects are pretty common. Various heart structure problems can occur. Things like TAPVR, which affects blood flow back to the heart, tetralogy of Fallot, a complex defect, or septal defects, holes between the heart chambers.
Serious heart conditions, potentially.
Potentially, yes. We also often see kidney and genitourinary problems, maybe a missing kidney or an extra one, sometimes hydronephrosis, which is swelling because urine can't drain properly, or cryptorchidism in males' undescended tests.
Kidneys and GU system too. What else?
You can also have things like cleft palate or cleft lip, hernias are possible, other gastrointestinal anomalies like issues with the biliary system or intestines. Skeletal problems might show up as scoliosis, a curved spine, or micrognathia, which is a small lower jaw, or just other variations in bone structure.
It really affects so many different areas.
It does. And then there's growth and development. Short stature is common. Intellectually, it's quite variable too. Only about 30% or so experience intellectual disability, and it's often mild to moderate. Many individuals actually have normal cognitive function.
That's really important to note that normal cognitive function is common.
Very important. And then there are even rarer things, some neurological findings, like Duane syndrome, which affects eye movements, or other ocular motility disorders. There was actually a study in 2023 from China looking at a family.
Oh, yeah?
Yeah, they found a specific, relatively small duplication on chromosome 22q11, about 1.7 megabases, that seemed to specifically cause these eye movement disorders. So research is still broadening what we understand as the full clinical spectrum.
That's incredible. Just a huge range of possibilities. Given that spectrum, are there particular symptoms or maybe combinations of symptoms that doctors find most challenging? Especially if that classic triad isn't there.
That's a really good question. The variability absolutely presents challenges for diagnosis. Often, it's when you have a combination of the less common findings, or maybe only one or two parts of the triad are present.
Right.
That's when clinicians really have to, connect the dots. Maybe they see an unusual pattern, some cardiac issues, maybe a kidney anomaly, some subtle facial features in a newborn. Even without that clear cat eye, that might be the clue.
So it's pattern recognition.
Exactly. Because none of these symptoms taken alone are only found in cat eye syndrome. It's the constellation, the pattern of multiple, sometimes seemingly unrelated issues that points towards the diagnosis.
Okay, that makes sense. So knowing all these varied symptoms, what's going on at the genetic level? How does that extra piece of chromosome 22 such a wide array of effects?
Right, so digging into the genetics. As we said, it's that extra small supernumerary marker chromosome, the SSMC. It results from a partial duplication leading to 3 or 4 copies. trisomy or tetrasomy of that specific region. 22 Peter to 22q11.
And how does that extra piece usually get created?
The main mechanism is thought to be something called non-allelic homologous recombination, or NAHR. It's a kind of error that can happen during meiosis when egg and sperm cells are formed.
Like a copying error.
Sort of, yeah. Think of it like the DNA copying process getting mixed up, leading to rearrangements where a segment gets duplicated and ends up on this extra little chromosome. This explains why it's often de novo, a spontaneous event.
Right.
But, as we mentioned, it can also be inherited if a parent is mosaic for that SSMC.
So spontaneous is most common, less than 1% recurrence risk usually. But if inherited from a mosaic parent, it's more like 50%.
That's the gist of it, yes. Autosomal dominant inheritance in those familial cases.
And you mentioned mosaicism before, both in parents and affected individuals. How does that influence things?
Mosaicism is absolutely key to understanding the variability.
Okay.
So, several factors modify the phenotype, the observable traits. One is the copy number. Is it trisomy, 3 copies, or tetrasomy, 4 copies? Tetrasomy often leads to more severe features.
Makes sense.
Then there's the level of mosaicism. What percentage of cells in the body actually carry that extra marker chromosome? Is it 10%, 50%, 90%?
Right.
And crucially, which tissues have the SSMC? Is it mostly in the blood, or is it heavily present in the developing heart tissue, or the eyes, or the kidneys? The distribution matters hugely.
Wow. So it's not just if you have it, but how much and where.
Exactly. That helps explain why 2 people with the same cat-eye syndrome diagnosis can look very different. Researchers have also pinpointed some candidate genes within that critical duplicated region on chromosome 22 genes like CECR1, SLC2518, ATP6V1E1 that they think might be driving some of the core features when they're present in extra copies.
That concept of mosaicism is really striking. What's maybe the most surprising thing mosaicism tells us about genetic conditions generally? Does it sort of challenge the idea of just having or not having a condition?
That's a fantastic point. I think the most surprising or maybe counterintuitive insight from mosaicism is precisely that genetics isn't always black and white. You don't just have it or not have it.
Right.
Mosaicism reveals the spectrum. Someone can carry the genetic alteration in some cells but not others, leading to this incredible range from mild to severe effects or affecting only certain body parts. It really challenges any idea of a fixed genetic blueprint determining everything. Instead, it shows how the distribution and the proportion of cells with the genetic chain can dramatically alter the outcome. It's a powerful illustration of the body's complexity, really.
Yeah, absolutely. So with this complex genetic picture and all the possible symptoms, how is cat-eye syndrome actually diagnosed? And then, once it is, what does managing it involve?
Okay, diagnosis. It often starts during pregnancy, actually. A routine prenatal ultrasound might pick up some anomalies, maybe a heart defect, or kidney issues, or perhaps even those characteristic eye fissures if they're visible.
So ultrasound can give the first clue.
It can. And if there are suspicious findings, then more definitive tests are offered. Things like amniocentesis, where they test fetal cells from the amniotic fluid, or specific genetic tests like chromosomal microarray, CMA, FIH analysis, or a karyotype. These look directly at the chromosomes for that extra marker.
Okay. And after birth?
Postnatally, the diagnosis is usually suspected based on the physical findings, maybe some combination of the triad features or other associated anomalies we discussed. Then it's confirmed with a chromosomal analysis, usually from a blood sample.
Right.
And a key part of the diagnostic process is a really thorough clinical evaluation, a multi-system assessment, checking eyes, ears, heart, kidneys, development, everything.
So checking all the potential areas. Now, you mentioned dosage effects earlier.
Yeah.
How does that tiny extra chromosome actually cause these specific problems in development?
That's the core question of pathophysiology, right?
Yeah.
How does it work at the cellular level? That extra chromosome, carrying extra copies of genes from that 22q11 region, leads to dosage effects, or gene overexpression.
Meaning too much of certain proteins.
Essentially, yes. Having extra copies of these genes means the cell makes too much of the proteins they code for. This disrupts the delicate balance needed for normal development. Think of it like adding too much of one ingredient to a complex recipe. It throws everything off.
Okay.
And again, the extent and severity of this disruption are heavily influenced by mosaicism. Which tissues have the extra chromosome and how many cells within those tissues have it? This directly impacts how specific organs develop, like the eyes, the anorectal region, the heart. The gene dosage imbalance messes with those specific developmental pathways.
It really paints a picture of delicate balance. So how is it managed then? Is there a cure?
Unfortunately, no, there's no cure for the underlying chromosomal change. Management is entirely symptomatic and supportive, and it has to be highly tailored to each individual because the needs can vary so much.
Makes sense. What does that typically involve?
It often involves quite a bit of surgical intervention, especially early on. Repairing anal atresia is common. Surgeries might be needed for other GI or urogenital malformations. Corrective surgeries for congenital heart defects are also frequent, and these can be complex, often requiring ICU care afterward.
Okay, surgery is a big part.
It can be. Eye surgeries might also be necessary, maybe to repair a coloboma for functional or cosmetic reasons, or to treat related issues like amblyopia or lazy eye.
And beyond surgery?
There's crucial ongoing medical care and surveillance, for instance, nephrology follow-up for kidney issues. Maybe medications like ACE inhibitors are needed.
Okay.
Regular ophthalmologic monitoring is vital to check eye pressure, manage any scarring, and optimize vision.
Right.
Hearing needs to be assessed regularly. Sometimes hearing aids are needed, and speech therapy is often beneficial. If there are GI issues after surgery, bowel management programs might be required.
What about development?
Absolutely critical. Developmental support through therapies, speech therapy, occupational therapy, physical therapy is often essential to address any delays, motor skill issues, or skeletal problems.
It sounds like a whole team is needed.
Definitely. And genetic counseling is a really important piece, especially for families. It helps them understand the diagnosis, the potential inheritance patterns, recurrence risks, and options for future family planning. This often includes testing the parents for mosaicism.
That counseling piece seems vital.
It really is. And overall, it requires long-term, multidisciplinary care. Regular checkups monitoring the kidneys, heart, eyes, growth, and development are needed throughout childhood, with a planned transition to adult care providers who understand the condition.
That's a comprehensive approach.
Sure.
So thinking long term, what does the future generally look like for someone with cat eye syndrome? And how is our understanding of it still evolving?
Well, the overall prognosis is generally quite good. Lifespan is usually normal unless there are very severe, life-threatening heart or kidney problems, for example.
That's reassuring.
It is. And as we discussed, cognitive outcomes are broad. Many individuals have normal intelligence, while others might have mild to moderate intellectual disability requiring educational support.
Okay. And what about prevention? Is there anything?
There's no way to prevent the genetic change itself, no vaccine or drug. So primary prevention really focuses on reproductive guidance. That means offering prenatal genetic screening if ultrasound finds potential issues or if there's a family history. And genetic counseling is key for families who know they carry the risk, like a mosaic parent.
Right. Informed choices.
Exactly. And public health plays a role too, largely through the amazing work of rare disease advocacy groups. Organizations like Chromosome 22 Central or Cat Eye Syndrome International, they do so much to support research, raise awareness, and provide resources for patients and families.
That support network must be invaluable.
Immensely so. And our scientific understanding is still evolving. Research continues. Studies like that Chinese family study on eye movements we mentioned, ongoing analysis of prenatal cases, better understanding of mosaicism, it all helps refine our knowledge of the full clinical spectrum and the subtle genetic nuances of CES. It's definitely a condition we're still learning more about.
So if we were to sum this all up from our deep dive today, cat eye syndrome is this rare chromosomal disorder stemming from that extra marker from chromosome 22. It causes a really wide, highly variable range of symptoms across multiple body systems.
Exactly. From the classic triad, which isn't always present, to heart, kidney, skeletal, and developmental issues.
And diagnosis relies on clinical suspicion, looking for those patterns, confirmed by genetic testing. Management isn't curative, but it's supportive, multidisciplinary, and has to be totally individualized.
That's right. And importantly, despite all the potential complexities, the prognosis for many individuals is generally favorable with the right interventions and lifelong support and, advances in genetics and just reporting these varied cases keep deepening our understanding all the time.
It really makes you think when you consider that incredible variability, even sometimes within the same family, and the huge role that mosaicism plays, how much the marker chromosome is present and where it just highlights how uniquely individual development is. How these seemingly small genetic differences can lead to such different outcomes. It really challenges us, doesn't it, to think about that complex dance between our genes and, well, our unique selves. Thank you for joining us on this deep dive into cat eye syndrome.
And that's a wrap on today's deep dive into cat eye syndrome. If this episode helped you understand your health just a little better, go ahead and hit that like button. Got thoughts, questions, or your own experience to share? Drop a comment below. We'd love to hear from you. Make sure to subscribe to Diagnose Deez so you never miss a breakdown of the illnesses that impact real lives every day. Follow us for more straight talk on the science of sickness, because knowledge is power when it comes to your health. And don't keep this info to yourself. Share it with someone who needs it. Until next time, stay informed and stay healthy.